Good morning, ladies and gentlemen, and welcome to the COVID-19 Awareness and Informational Online Seminar. For the last few months, the world has gone through a situation that has not been repeated many times in recent history. It can be called a war, but not started by any country or armed force, but by what appears to be one of the most destructive pathogens representing a high risk to human life. Of course, we're talking about the coronaviruses, which are a large group of viruses that can cause disease in animals and humans, often circulating around animals such as cats, bats, and sometimes they even infect humans. The coronaviruses that can infect people were first identified in the 1960s, and they have been very closely monitored by public health officials since then, since it represents a very high risk to become a pandemic. On November 17, 2019, a new strain of this virus was discovered by the scientists and doctors in a hospital in Wuhan, China, and diagnosed the first patient with this strange condition that we all now know as COVID-19. A group of Chinese doctors raised awareness about the issue, highlighting the potential risk that it had to become a pandemic. And approximately 2 months later, the World Health Organization recognized this virus as a pandemic, leading many countries to close their borders to protect their people. This new pandemic collapsed the health system of many countries and have left a significant damage in the economy of many cities, including epicenters of economic activity such as New York, Madrid, and London. Many first world economies such as Italy, Germany, France, Spain, and even the United States have been severely impacted by this pandemic, leaving people without jobs and therefore without any income to survive through this hard and unprecedented times. The COVID-19 is a threat to the life of many people, especially those who suffer chronic conditions such as diabetes, high blood pressure, Parkinson's disease, pulmonary illnesses, among others. Face masks, hand sanitizers, and in some cases even gloves have been imposed by governments as a precautionary measure to protect their people from being infected. Among the symptoms of COVID-19, people have experienced shortness of breath, fever, sore throat, fatigue, loss of taste and smell, headaches, congestion, nausea, and even diarrhea. More than half of the people infected have manifested that they are asymptomatic, which means that the virus has not affected them at all and they don't have not even one symptom and no changes in their state of health. With more than 13 million cases, it has taken the life of more than 570,000 people around the world as of July 12, 2020, leaving us with a death rate of almost 4.4%. Scientists from all around the world are in the process of developing a COVID-19 vaccine, and some laboratories, such as a German biotech firm, are optimistic enough to say that it will be available for the public by December of this year, 2020. As of today, the pandemic keeps affecting the population and the amount of cases keeps growing exponentially in numerous countries, especially in the United States, whose 4 of their 50 states, Florida, Texas, Arizona, and California, have been reported all-time records every single day. COVID-19 will pass to history as one of the most powerful pandemics due to its easy way of contagion, and the world keeps struggling to adapt to the new normality and is working to get economies back on track after all the markets hit an all-time low.